Okay, this video is about brain gross anatomy and how it relates to our health and what we can do to improve our health based on this knowledge. So basically, gross anatomy means you can see it with your eyes as opposed to looking at it with a microscope. First of all, we'll talk about a sea squirt. In its juvenile phase, it has a brain. It swims around like a tadpole. In its adult phase, it attaches to a rock. It becomes a filter feeder. And the point is, its brain is reabsorbed once it's an adult filter feeder, because you don't need a brain if you just sit around. And that relates to humans too. The brain is a use it or lose it system. If you continue to think and to exercise, you'll maintain those abilities pretty well. Versus if you stop doing something for a while, you very often as you get older, you lose the ability to do it. A couple quotes that help the brain to function optimally. Voltaire had said, "Why do animals have brains but plants do not?" And it's because animals move. As soon as you move, you have to know what a destination is. To choose a destination, you have to make a value judgment. I will go towards the fruit tree to get something to eat. I'll avoid the coyotes over there because they're dangerous. Okay, then you have to navigate to get to your destination. You have to remember how to get back. You have to avoid obstacles in the way. So all of that means that it takes a lot of neuronal resources to move. In addition, the more you exercise, the more brain cells you form. It's called neurogenesis. So that's good for maintaining the brain and protecting the brain against cognitive brain diseases. Okay, what's the purpose of the human brain? That you could walk down a path in a forest, a jungle, a prairie, and you could survive. The purpose of the brain is to keep you alive and to help you to reproduce, okay? And also, it helps to become better at thinking. Thinking is something you actually train. You go to school, you just memorize stuff, you know. And you get programmed to be kind of conformist and to just trust, authority, whatever you're told, and to be kind of conformist and stupid. You actually develop your brain by thinking on your own, trying to figure things out, reading, having conversations with people. Here's a quote from Thomas Carlyle: "There's always a good reason, and then there's a real reason." Quite often you will see this. In real life, you always get told this is the reason for something. But it's not really the real reason. The real reason is the person's trying to sell you something, trying to make money off you, trying to chump you, or whatever. But if you keep that in mind, what is the real reason, you'll be much better at thinking. And then here's a good quote from Ayn Rand: "If you think there's a contradiction, recheck your premises. Contradictions do not exist. Whenever you think you're facing a contradiction, check your premises, and you will find that one of them is wrong." That really helped me a lot. Once I got my thinking straight, I realized, all right, the reason she never calls me back is because she doesn't like me. Okay, fine. Look for a next woman. All right, so those types of things, they help you, okay? Guys need that. We're not the best socially adept thinkers. If you want to understand something, take it out to extremes and examine the opposites. That quote comes from John Boyd, an American fighter pilot. And that's real helpful too. Look at the opposite situation. Quite often, the way to figure something out is say, what if the opposite were true? What if the opposite were true? That happens all the time, that the opposite thing is true. So keep that in mind, you'll be a better thinker. Ordinary words convey only what we already know. It's from metaphor we can best get hold of something new. That's from Aristotle. Yes, it is from metaphors that we connect things to what we already know. And that's how we learn stuff. We take the new thing and we associate it with something we already know. That's how the brain maps cognitive space. That's an interesting point. The brain maps everything, and it maps cognitive space through analogies, through metaphors. Okay, now, next point is how we're going to now talk about the brain from top to bottom. Okay, or from bottom to top. So theoretically, almost from an evolutionary type of point of view, the lizard brain, reptile brain is the brain stem, and that's just for the most basic things. Maintain your heartbeat, your blood pressure, and it just wants to get some food, have some sex to reproduce, and that's it. Reptile lays an egg, walks away, doesn't have to do anything. Okay, doesn't worry about child support or nursing the kid. All right, the next level of the brain is the mammal brain. That's the cingulate gyrus in continuity through the isthmus here into the medial temporal lobe, which is on the side. You can't really see it on this picture. And that's shaped like the letter C, like the Chicago Bears football helmet, letter C. And that's also called the mammal brain or the limbic brain. Limbic just means the medial edge of the brain. And that is different for a mammal than a reptile because a mammal has a family. It has to nurse the baby, pay attention to it. It worries about the baby. And that's also called the emotional brain. It's rather fast and impulsive. And when you're in a fight or flight state, you're all worried about something, you kind of shut down blood flow a little bit to the frontal lobes and you just intensely react and quickly react. It gives you that extra energy for fight or flight. Now, the last part of the brain, as we move further vertical, up here is the neocortex, new cortex. Cortex is Latin for bark, like the bark of a tree out in the periphery, and that's where our gray matter is, the cell bodies of our neurons. And that's our thinking brain, for thoughtful, effortful thinking, for willful decision-making. And that's better for sophisticated thinking, to make a mature, wise decision about something. So that's basically the brain from bottom to top, the vertical way to look at the brain. A little bit on the brain from front to back. The further posterior one is in the brain, like here's the occipital lobe, that's pure sensory, okay? Then as one goes more forward, this front part of the brain here, the opposite side, that's the most abstract part of the brain, where we make value decisions and judgments. Do we like something? To get yourself to do things that are hard for you to do. You know, will I delay gratification? I won't go out with my friends tonight because I got to study this weekend. I got to write a paper. I got to take a test. Whatever. So we have the ability to get ourselves to do the thing that's less immediately desirable, but from a long-term point of view is better for us. And it's also the seat of personality. The frontal lobe is where your quirky little sense of humor comes from, and all those sort of a lot of fun things that we enjoy in life that makes us more human. A lot of medications, like an antipsychotic medication, sort of shuts down the frontal lobe. It's almost like a chemical lobotomy. Okay, a surgical lobotomy would be like to cut off part of the frontal lobe. Okay, interesting thing is also about this brain. So the more you go from back to front, the more you go from sensory to, in the frontal lobe right here is motor, and then up here is abstract thought. The more frontal you are, the anterior you are, the more abstract your thought. Cerebellum is kind of unique. It's in the bottom there, below the tentorium, infratentorial. Out of all the neurons in the brain, what percent do you think are in the cerebellum? It's actually about 70%. And that's because it's got all these short-length interneurons for very fine coordinated motion like writing. Short-length interneurons, that's why you can pack so many into that one little spot, because it's really small compared to the rest of the brain. So it's 70% of your neurons. And that's why, you know, the computer programmers can make a robot do calculus back in the 1950s, but they still can't make one that can ride a bicycle in coordinated fashion. It actually takes a lot more neuronal resources to do coordinated, smooth movement than it does to do mathematics. And that's also why most of our brain is devoted to motion and movement and navigation and things like that, rather than, you know, what we would consider perhaps complicated, doing math and calculus. Okay, here's just a picture of the main brain networks. There's other brain networks, but these are the main ones. So the default mode network here, DMN, default mode network, past and future. This is how the brain maps time. So the default mode network, if you take a patient, you put them on a functional MRI table and you ask them, so what you thinking about? The patient will typically say, well, I'm thinking about my relationship, you know, my girlfriend, you know, we were talking yesterday, and I think she really wants to go to this movie, even though I don't want to go to this movie. It's kind of a chick flick, but, you know, maybe it'll be good. So I guess tomorrow we'll go. Okay, so that's going back and forth from the past to the future. And that's how the brain maps time, whereas the outer convexity, it's called convexity because it's convex outward, is a task-based network, and that pulls you into the present. And that's getting busy with something at school or with your job, for example, or exercise and working out. And the point being is, when you're pulled into the present, then that's helpful to a person. Let's say a person is depressed, psychologically, they're sad about something, whatever it might be. Getting busy with a task is one of the best things they could do, because now this part of the brain is going to be active. Okay, the salience network is located, this area is called the insula, like an island. You know, this is like a little inlet river come to the island, the docking station, the insula. And it also, the salience network involves the hippocampus, sort of the declarative memory center of the brain here. And the point of salience is it means to pay attention. So basically, if you're sitting here talking to somebody and somebody turns on a TV, you see the motion on the TV, it's sort of like the rod's black and white vision in the periphery of your eye detects motion, then you turn your head to get stereoscopic vision with both eyes and your tightly packed cones and your fovea, your macula, and you look and see what the thing is. You can't help but pay attention to it. So the point is, you know, let's say you're busy studying. Sometimes I'll put ear protectors on. I'll put these things on so that I can study and I don't lose that bandwidth of my brain ability to distractions from noise or whatever else. And I don't have anything else going on but what I'm doing, the one thing. So anyways, those are the three main networks of the brain. And part of the reason I'm going through all this is I'm going to progressively build towards more and more sophisticated, interesting subjects about the brain and about cognition. And this is building the knowledge base that'll enable us to constantly move into more complex topics. Okay, so real quick, now we're going to go right and left brain. This guy right here is Ian McGilchrist. He's a psychiatrist. I think he's from England. Got a little bit of an accent. He wrote an interesting book. His book's called Mastering the Emissary, and it's a pretty good book. Kind of long-winded, but it's good. And he's a bright guy, very articulate. You know, English people, their accent always makes them sound smarter than they really are. Okay, so anyways, though, he has the best I've ever seen example of how to think about right and left brain. So here's the bird, and the bird is us, it's you. All right, and so the bird is trying to eat some bread off the ground, and it's bobbing its head up and down, and it's focused on the details. That's left brain, a detailed task that's very specific. L for left brain, L for linear language, but it's a simple type of language. Could you please pass the pepper? Oh, certainly, thank you. Okay, it's sort of Apollonian, like the Greek god Apollo, precise logic. It's a deductive logic. That's also a predator mentality. If I run here, I'll intercept right there. Got it. Okay. It tends to overestimate its accuracy. Like the typical academic thinks they really know what they're talking about. And a lot of times, like, you know, what they're saying is an ignorant joke. Okay. But they don't think so. They think they really are the big expert. Okay. It's overly optimistic and confident about its conclusions, which quite often are inaccurate, but it thinks they aren't. All right, right brain is more fun. It's metaphors and jokes and singing. A person can be stroked and not be able to speak well, but still have the ability to sing. And sometimes that's one way you can communicate with a stroke patient. It's more Dionysian in terms of the Greek god Dionysus. It's more kind of fun, more social, theatrical, jokes, humor, big picture thinking, the artist brain, producing art. And it's more of an inductive logic. And that's more of like prey. And that's what it means. Like, that's why I love this picture. The bird's sitting here with his left brain activity, picking the pieces of bread off the ground, but its right brain activity is, oh shit, look on top of the fence. Here comes a raccoon. He might try to kill me. Oh my God, here comes a dog. Thank God he's on a leash, but he still might come and get me. Maybe I should take off. Well, one more piece of bread. So that's how the brain actually functions in real life. And if you're interested in learning more, Ian McGilchrist will give you all you could ever want to know about the right and left brain information. Okay, here's just a picture. We're going to now, well, we talked about the networks. We're going to get into some more stuff. Let me go to the next slide here. Okay, now we're going to look at, this is a transverse section through the brain. And this is like one of the most famous pictures you could ever see if you're a radiology resident, neurology resident. This is like a board's question on every test. To look at the brain at this level, this is called the basal ganglia level, the deep nuclei, cell bodies located in the center of the brain. And it's sort of the relay station. The thalamus is like the main relay center between the spinal cord and brainstem up to the cerebral cortex. All kinds of brain activities going up and down through these things between the brain, the brainstem, the cerebellum, and the cerebral cortex, supratentorial brain. Okay, this little insula is like we talked about on that coronal picture before. Coronal is front to back. Okay, axial is the same thing as transverse. And so now the reason I'll remember this is just a couple things to know about it. This is called the internal capsule. The little, it looks like a boomerang, sort of. It's shaped from here up through here. And the posterior part of this boomerang, internal capsule, is where your corticospinal tracts are. That is your motor tracts to get your body to do stuff. And they're located, everything in the brain is sort of mapped out. So right in the, this is called the genu. Genu means like a knee, something where it bends. So right in the genu of the internal capsule right here. So here would be the front of the boomerang. Here's the point of the boomerang, the back of the boomerang. So in the, near the genu of it is H for head, A for arms, and then L for legs below. And if you have a stroke right here, you'll damage something in your head. If you have a stroke right here, you'll damage something in your arms, your upper extremity. Stroke down here, you'll damage something in your legs. This is a super common, I called it stroke land for hypertension. Every day goes by, I'll see at least about 50 strokes in this area. Every day, tons of them. Super common with hypertensive patients. They stroke right down here. I'll show you a picture in a moment about the blood vessels, why that happens. Here's a globus pallidus, and the way I remember these names is I always just make up a little story. Globus pallidus is pals with the internal capsule, a pal with Hal, okay? The putamen is the name of the nucleus. Nucleus just means where the cell bodies are, the nuclei of cells. So the putamen is right here. It's on the outer part, and I say, oh, that's to put a man out. It's on the outside. Like he pissed off his girlfriend, his wife, and she's put him in the doghouse for a while. So he's out here. That's how you can remember putamen is on the outside. And then the insula is right over here, and the insula is called like an island. It's also called insular cortex. Okay. So that's how you can remember all the stuff here. These are just where the cerebral spinal fluid is. FH is frontal horn. 3 is for third ventricle. OH is occipital horn of the lateral ventricles. So that's the axial transverse section anatomy of the brain. And by the way, the stuff I'm showing you is pretty much how when I teach a medical student or a young doctor or resident on radiology or something, this is how I would teach them the key points of brain anatomy before later on we'll go into individual cases. All right, so now we're looking at a coronal. This is a front to back picture of the brain. So here's the top of your head is up here. Here's the bottom underneath your chin would be below here. And the reason I'm showing you this picture is just to learn a little vocabulary, and this is a key thing to understanding stroke. So at the level of the lateral ventricles, this is the lateral ventricles of the body of the lateral ventricles of frontal horns, depending on how far anterior we are. We'd be about in the body of the lateral ventricles at this point. Here's the third ventricle right here. At this level is called corona radiata, because when you look at it in a gross section, it looks like a crown. So radiating crown. Corona means crown, radiata is to radiate. Centrum semiovale is centrum. It's in the center of the brain when you look at a transverse section. And it's semi-oval in terms of the shape of the brain is sort of oval. So the deep white matter up here, white matter means myelinated fibers covered with fat, with the myelin. Okay, the gray matter is in the periphery. It's also called cortex because it's like the bark of a tree in the periphery. And now we'll just describe names of, so peel is the outer surface of the gray matter right here, peel. Subcortical means just deep to the cortex. And the reason all these things matter is I have to describe where strokes are, so I have to know all this vocabulary to precisely describe a stroke. The deep white matter is in here. This would be called periventricular, near the ventricle. If it's touching the ventricle, it would be juxtaventricular. Juxta is to yoke something to the ventricle. All right, basal ganglia level is right down here. So these are key levels. These are talked about all day long, every day by neuroradiologists, neurologists. Okay, basal ganglia level, then just more cephalad. Higher up to that is corona radiata level, centrum semiovale level. So right in here at the basal ganglia level, this is the internal carotid artery, comes up, bifurcates. Here's the middle cerebral artery, gives off lenticulostriate arteries into the basal ganglia. And these are the ones that stroke out all the time with hypertensive patients. Super common to get hypertensive infarcts in here. They're often called lacunar infarcts. And the reason is when you got this high pressure blood coming in, the high pressure over time just keeps on damaging these lenticulostriate arteries, and eventually the pressure goes real high, they stroke. So I see those every day. Okay, then here's the other thing about hypertension, why you're double screwed with hypertension, is then the blood travels out along the outer surface of the brain. Okay, then it gives little penetrating arteries that come into the brain tissue. And the point I'm trying to say is the deep white matter at about the level of the lateral ventricles, right here, this is called the periventricular white matter of the corona radiata, and a little higher up of the centrum semiovale. So centrum semiovale just means above the lateral ventricles. This is the area that gets screwed. If you overtreat hypertension, the person's hypotensive, or for whatever reason they drop their pressure relative to the metabolic demands of these cells, and you get tons of silent strokes in these areas. Pop, 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 pop. Every day I see hundreds and hundreds of them. Okay, tons of them. It's the most common type of stroke. It's these silent strokes in the deep white matter. Okay, and it's because it has relatively poor blood supply. The human brain is designed for us to run around outside eating plant foods. When people start eating all this modern junk, all this meat, all this oil, all these processed foods, they make their blood thick, high viscosity blood, and they'll underperfuse these areas. Plus, they'll have insulin resistance. They'll have sodium, vasoconstriction on board, so they often get silent strokes in this area. When I say silent, sometimes they're very symptomatic, but a lot of times they're association cortex. You just get stupider and stupider. It's progressive cognitive decline. You also get a form of apoptosis as well, but I'm saying I put a skull and crossbones in here because this part of the brain gets trashed on a routine basis with people who've got all the standard risk factors: diabetes, coronary artery disease, hyperlipidemia, and hypertension. This is so common, it's ubiquitous. It's expected in a person over 60 that they're going to have some silent stroke brain lesions. Okay, and that's why I hear all these people, oh, where are you going to get your good fats? Yeah, right. You want to know the biggest epidemic in the whole country? All this type of stuff. Diabetes, hypertension, metabolic syndrome, atherosclerosis. This is so ubiquitous, it's not even funny. We consider it normal aging. It's not. Okay, here's just a picture of the lateral surface of the brain, and I'm just going to show you real quick a trick that's very effective. There's a guy by the name of Thomas Nadich. He's a neuroradiologist out in New York at Mount Sinai Hospital. He's a brilliant guy. Out of all the neuroradiologists in the world, he has the best understanding of brain anatomy, okay? And here's a trick that he made up to memorize the anatomy on the outer surface of the brain. It's brilliant and it works. It's easy. Think of a snail here. This is a visual metaphor. The Sylvian fissure located between the frontal lobe and the temporal lobe looks like a snail. Here's its head, here's its antenna, here's its body, and its little tail curving upward right here. If you can find the snail, and it's easy to find on the side of the brain, the convexity, the outer convex part of the brain, you can name everything on the brain very quickly. So as soon as you find this, you have the area around it's called the operculum. Operculum means a cover. It's the cover of the insula, that inner island I showed you earlier. And so the part on top of the orbit is P. It stands for pars. Pars just means like part in Latin. Pars orbitalis. The part between the antenna is shaped like a triangle, pars triangularis. The part right behind it is called pars opercularis, summarizing it's all part of the operculum. And then the vertical sulcus behind it is the precentral sulcus. So you know immediately behind that you're in the precentral gyrus, primary motor area. This is the big central sulcus which divides the frontal lobe and the parietal lobe. Right behind it is postcentral gyrus, primary sensory area for touch, kinesthetic sense. Okay, if you go on top of the Sylvian fissure, right over the margin of it, that's the supramarginal gyrus, Wernicke's area. That's for understanding speech. By the way, the operculum right here is the inferior frontal gyrus, and that's part of Broca's area for producing speech, motor speech. Everything frontal lobe controls motor. Okay, it's primary motor up in here, supplementary motors right in front of it. And you can name these real easy. Superior frontal gyrus is above the superior frontal sulcus. Middle frontal gyrus. Inferior frontal gyrus. Okay, and the temporal lobe, same thing. Superior, middle, and inferior gyri. And then we'll go through, the occipital lobes and stuff are best seen from the midline sagittal brain. But all you do is you go with that visual metaphor, and it's good to make these, and you can derive everything else. That's the irreducible minimum from which everything else can be derived. And it's very good, like if you study anatomy, sometimes, if let's say you're a resident, you're going to rotate through neuroradiology 1 month and then not go back to it for another 6 months. If you have this snail in your mind, you'll very quickly relearn it super fast. Okay, this was just part of the anatomy for the glymphatic system and the cerebrospinal fluid system, which I talked about in my glymphatic lecture. So if you're interested in how the brain cleans itself at night with the glymphatic system, I'll go into more detail. I'll go through all these pictures more. A lot of our waste products are expelled through the arachnoid granulations and through the glymphatic system. We talked about the glymphatic system, how the brain does not have lymphatics within its parenchyma, but it does have lymphatic tissue in the dura just adjacent to the superior sagittal sinus. So brain waste products will be dumped into these lymphatics, and then they will travel down into the neck lymph nodes, and that's been proven. Okay, besides in rodents, even in humans too now. Okay, we talked about the glymphatic system, how the perivascular space of Virchow-Robin opens up at night. It can't open up in the daytime because the neurons need a precise ionic milieu in order to fire their action potentials precisely and to be able to think and do all the things we do. But at night while we're asleep, neurons can go offline, drop out their waste products like, Victorians emptying out their chamber pots, and then the cerebrospinal fluid from the perivascular space of Virchow-Robin washes across from the arterial side to the venous end because the blood-brain barrier permeability at this location is opened up. The little green thing is an astrocyte. Astro, like a star, cyte is a cell. We're almost done here, and if you want more on glymphatic system, my other lecture will go in way more detail, but I just wanted to include it here real quick for people who haven't seen it before. So here's a better drawing. It comes up. This is from the work of Macon Nettergaard, PhD. She's one of the discoverers of the glymphatic system, and you can see the cerebrospinal fluid. It's pushed by the arterial pulsations, travels through the brain parenchymal tissue, and it pushes neuronal waste products here into the perivascular space of the vein, and then they're expelled. These are aquaporin proteins that facilitate the transfer. This was just showing that it's these arterial pulsations through those lenticulostriate arteries located at the base of the brain. They're like an Archimedes pump, and they push the cerebrospinal fluid into the brain at night when the permeability is opened up. Okay, then this was the picture we talked about showing how you get the strokes in there from hypertension. So if your blood pressure is too high, you stroke out here in the lower part of the basal ganglia. versus if your pressure is too low, you overtreat your hypertension, then you're screwed. You'll drop blood flow to the watershed, which doesn't have any good artery getting right to the center of it. So that was just an overview introduction to the anatomy of the brain that'll prepare us then to learn other things. Hope that was helpful.